Hello everyone and welcome back. If you've ever felt that burning, tingling, or pins and needles sensation in your feet, as if you were walking on hot coals, you know it's not just an annoyance. It's a pain that steals your sleep, limits your steps, and turns a normal day into torture. It's what we call burning feet. I know how frustrating it is. You try taking off your shoes, soaking them in cold water, but the relief is fleeting. The good news is, you are not alone, and there are real solutions. In this video, we're going to dive deep into the mystery of burning feet. We'll uncover the 4 main categories of causes, from the simplest to the most complex. And most importantly, I'm going to give you an arsenal of relief, with immediate techniques and long-term strategies you can start using today. Stick with me, because what you're about to learn could be the map for you to finally walk pain-free. To fight the fire, we need to know what's fueling it. The burning sensation in your feet is most often a sign that something is irritating your nerves, and the causes fall into 4 major groups. Cause 1. The nerve short circuit, also known as neuropathy. This is the most famous and often the most serious cause. Peripheral neuropathy is essentially damage to the nerves that send signals from your brain and spinal cord to the rest of your body, including your feet. The big villain here is diabetes. High blood sugar levels, over time, corrode the nerve fibers, causing them to send pain and burning signals, even when there is no actual heat. But that's not all. Neuropathy can also be caused by vitamin deficiency, especially B-complex vitamins, like B12 and B6, which are crucial for nerve health. Excessive alcohol use is another factor, since alcohol is a toxin that can directly damage the nerves. And certain medications, such as some used in chemotherapy, can also be culprits. If the burning is persistent, worsens at night, and is accompanied by numbness, neuropathy is a strong suspicion. Cause 2. The circulation blockage, or vascular problems. Your feet need a constant blood flow to stay healthy. When this flow is compromised, the tissue and nerves don't receive enough oxygen and nutrients, and this can generate the burning sensation. We're talking here about peripheral artery disease, or PAD. PAD occurs when the arteries that carry blood to the legs and feet become narrow or blocked. It's kind of like trying to water a garden with a kinked hose. The lack of blood can cause pain, especially when walking, and at rest, it can manifest as burning. Cause 3. The surface attack, which involves infections and biomechanics. Sometimes the problem is more superficial, but honestly, it's still no less painful. For example, athlete's foot, also known as tinea pedis, is a pretty common fungal infection. It causes intense itching, peeling, and, yes, a burning sensation, especially between the toes. Then there's the issue of inadequate shoes, probably the most common and, well, neglected villain. Tight shoes, high heels, or those made of synthetic materials that don't allow for any ventilation can create a hot, humid environment. This not only irritates the skin, but also compresses the nerves. And let's not forget about muscle fatigue and posture. Standing for long periods or having an incorrect gait, like flat feet or a high arch, can overload the muscles and nerves in your feet. That can lead to inflammation and, you guessed it, burning. Cause 4 is what I like to call the hidden triggers. These are systemic conditions. Sometimes, burning feet can actually be a symptom of something affecting your entire body. For instance, hypothyroidism, which is when your thyroid is slow, can cause swelling and nerve compression. There's also erythromelalgia, which is rare but quite serious. It causes intense episodes of heat, pain, and redness in the feet. And then, kidney failure. When your kidneys aren't functioning well, toxins can build up in your body and, over time, damage the nerves. Knowing the cause is the first step. Now, let's get to what really matters: how to put out this fire. Solution 1 is what I like to call the footwear revolution, the simple fix that actually works. Your shoes are honestly your foundation, so invest in them. There's something called the 3 C's test. Your shoes must have comfort, a firm counter, that's the heel cup, and a cabedal, which is the upper part, that allows for breathability. And don't forget about the toe wiggle room. Make sure the toe box is wide enough for your toes to move freely. Tight shoes are seriously the enemy of circulation. Cushioning and support matter a lot too. Look for sneakers or shoes with good sole cushioning and, crucially, and arch support that's appropriate for your gait. Orthotic insoles, whether they're custom or just good quality over the counter, can really help redistribute pressure and relieve nerve compression. Solution 2 is all about immediate relief, the quick rescue you need when the pain strikes. You need a quick response, right? Try the strategic ice bath. Soak your feet in cool water but not too cold, for about 10 to 15 minutes. The cold constricts blood vessels and reduces inflammation. But attention, if you have diabetic neuropathy, always use a thermometer to make sure the water isn't too cold, since reduced sensitivity can lead to cold injury. Another great option is the power of Epsom salt. Just add half a cup of Epsom salt, or magnesium sulfate, to a basin of warm water. Magnesium is known to help relax muscles and reduce inflammation. It's honestly an age-old treatment that really works. And finally, don't underestimate the power of elevation. Lie down and elevate your feet above the level of your heart for 15 to 20 minutes. Gravity helps drain excess fluid and improves venous return, which can really relieve swelling and pressure. Solution 3. Strength and flexibility, also known as the long-term game. Strong feet are healthy feet. So, let's talk about a few simple strengthening exercises you can do. First up is the marble pickup. Just place some marbles on the floor and use your toes to pick them up and drop them into a pot. This really helps strengthen those small intrinsic muscles in your foot. Next, try the ankle alphabet. While sitting down, lift your foot in the air and use your big toe to draw out the letters of the alphabet. This is great for improving ankle flexibility and boosting circulation. Then, there's the towel scrunch. Place a towel on the floor and use your toes to pull it toward you, scrunching it up as you go. Aim to repeat this 10 times on each foot. And if your burning feet are due to circulatory issues, light compression socks can honestly be a game changer. They help push blood back up and reduce swelling. Solution 4 is all about the anti-inflammatory diet. Think of it as the right fuel for your nerves. What you eat actually affects your nerves, so let's break it down. Focus on B vitamins by including foods rich in B12, like meat, eggs, and dairy, and B6, such as bananas, potatoes, and chickpeas. If you're vegetarian or vegan, B12 supplementation is honestly essential. Omega-3 fatty acids are also your friend. Fatty fish like salmon, walnuts, and flax seeds are natural anti-inflammatories that can help protect your nerve sheaths. And if diabetes is the cause of your burning feet, strict blood sugar control is really the only long-term solution. There's just no shortcut here. Now, let's talk about the warning signs and when to seek medical help. It's honestly vital to know when self-medication and home tips just aren't enough. You should seek a doctor immediately if the burning started suddenly, since acute and sudden pain can indicate a serious nerve or vascular injury. If the pain is spreading, especially moving up your legs, that's another red flag. Losing sensation, like complete numbness or not being able to feel temperature in your feet, is a sign of advanced neuropathy. If you notice any open sores or wounds that just won't heal, especially if you're diabetic, it's an emergency. And if the pain is accompanied by fever, this may indicate an infection. Remember, the correct diagnosis is absolutely key. A podiatrist, neurologist, or endocrinologist can help identify the exact cause and prescribe the right treatment, whether it's medication or physical therapy. We've reached the end of our journey, but honestly, your path to relief is just beginning. You now have the knowledge to understand what's happening and the tools to act. Remember, burning feet is not a sentence, it's a symptom. By taking care of your shoes, practicing those simple exercises, and paying attention to your body's signals, you really are in control. If you're looking for extra support for your feet, I've left a link in the description for a product that's helped thousands of people find the comfort they deserve. It's a resource worth checking out. If this video helped you take the first step toward lasting relief, please leave your like and share it with someone you know who's suffering from this pain. And don't forget to subscribe to the channel and hit the bell for more health and wellness tips. Leave a comment below with the hashtag #ChalkFeetOnFireNoMore and tell me which tip you'll try first. Thanks so much for watching. Take care of your feet, and I'll see you in the next video.